Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's look at some Streptococcus. Streptococcus lesions of the skin. So the first one being impetigo. So impetigo is an infection of the superficial layers of the skin, and it is present in the superficial vesicles, which break down and are encrusted by the honey-colored scabs. So it usually occurs in the children. Next, we move on to the erysipelas. The erysipelas, it is an infection of the superficial epidermis, and it is present as an erythematous raised lesions with the sharply demarcated edges. So it has a sharp demarcated edges. So this differentiates it from the surrounding skin. Sharp demarcated edges. Next, we move on to the cellulitis. So what we need to know is cellulitis can also be caused by the Staphylococcus. So in terms of the cellulitis, it is infection of the skin and the subcutaneous tissue. It is present with erythema and edema. It can be differentiated from erysipelas by erysipelas is a raised lesions, whereas the cellulitis is not. So erysipelas is raised lesion. So erysipelas, the name suggests it is rice. So it is easier to remember erysipelas is a raised lesion, and cellulitis is not. The cellulitis is poorly demarcated from the surrounding skins, whereas erysipelas is clearly demarcated, and this is clearly demarcated as well. Then we move on to the necrotizing fasciculitis. The necrotizing fasciitis. The necrotizing fasciitis is the infection involving the facial planes, and it is present with the dark areas of necrosis, erythema, and the edema. So it's going to include necrosis, erythema, as well as edema. Lastly, we look at the myositis and the myonecrosis. So myositis and myonecrosis is the infection of the muscle. Infection of the muscle. Channel.